Good afternoon. This is Christine Stapleton. I'm a reporter with the Palm Beach Post, and I'm here at 15 Park on 45th Street, waiting for the governor to speak to us about the coronavirus pandemic. The governor just arrived, and there are a number of issues that we're hoping that he'll address this afternoon. There's been quite a bit of confusion about registering for unemployment benefits. That is one of the biggest concerns right now for residents out there who have lost their job or their salaries have been cut. So the computer system is not working. We're hoping the governor will address that today so that you can find out how you can apply for unemployment benefits. We've got the Army Reserve is here. The governor now is moving over towards the podium, and we'll see what he has to say.
Well, good afternoon. I want to thank the mayor for being here. I want to thank Palm Beach County for the partnership. We are excited about opening up this test site. As many of you know, the Florida National Guard partnered with Broward Memorial Healthcare in Broward County, which at that time was really where the outbreak was most significant, and had a very successful operation. Then we were able to partner with the federal government and Miami-Dade County and do 2 sites in Miami-Dade, and obviously, you know, they've had a lot of positive cases that have come from those tests and other things, but we definitely see a need, and I've talked with folks in the county here and Jared over the last however many days about getting more testing resources here to Palm Beach County. If you look at the numbers in the state, Broward and Dade are by far and away the top. Palm Beach County's a distant third in positives, but Palm Beach hasn't quite had the testing volume, so we think it's really important to do that. This is a great facility for this. Obviously, most of us thought we'd spend our March watching the spring training, but life throws you curveballs sometimes. So this is set up, and this is designed to be a high volume test site. So, you know, I've spoken to the folks here. The goal is going to be to open this up. We want the, those 65 and plus that have symptoms to be the first priority, along with our healthcare workers and first responders, and try to get as many of those through as can. And then what's happened in other parts of the state is there's a limited demand. Eventually you fill that, and then you start expanding beyond that. But the goal here at Broward, we were doing 750 a day. I just talked to some folks at the Guard, and they want to do at least that much. And so the folks in Palm Beach know, I know they're getting people signed up, but we really believe the high volume is important, and so that's going to be the goal. And what we've done as the state of Florida is make sure we're surging resources here. So, you know, there's been a run on these collection swabs. No one can find them. So Jared is working hard to scrap these things up from around the country, buying them wherever we can. And, we're going to have thousands of collection swabs here because we know it's important to be able to offer testing for people here in Palm Beach County. And so there is the number to pre-register. I think they've already gotten a lot of calls, 561-642-1000, and there'll be an assessment by the Healthcare District of Palm Beach County. And the questions they're going to ask: have you had a fever in the last 14 days? Do you have a cough, trouble breathing, sore throat? Have you had exposure to anybody who's a known COVID-19 patient? And so that's part of the screening process. And then obviously the people that fit the criteria be able to come here, get tested. What they'll do once you get tested is we're still at the stage where you got to send it to a lab, and they have to run the lab test. We finally have gotten a handful of these rapid tests. We're using those mostly with healthcare workers, but we're also trying to get this new test from Abbott Labs, which is a 5-minute result. So we spoke with the executives on Abbott Labs. I spoke with the president personally and basically said, look, you don't need to buy it for us. Florida will buy it, but just make sure some of that comes here. So we think we're going to get some of that, and obviously be really excited about deploying that, because if you can get a result in 5 minutes, you're talking about the healthcare workforce, you're talking about nursing homes. It just gives us a huge amount of possibilities to be able to protect the people in the state of Florida. And so this will be, the 4th major site just in Southeast Florida that we've worked on in conjunction with local folks, and then some of them with the federal government. So we have the 2 sites in Miami-Dade at Hard Rock Stadium and at the Marlins Park. We have the Broward Memorial Healthcare, which, the National Guard stood that up like a week or 2 ago. And at that point, these drive-in testing sites usually didn't work when anyone would try them anywhere in the country. These guys did a great job. It was running smoothly. Memorial Healthcare did a great job, and they were going 750 people a day. Now, the demand has gone down a little bit in that community, which is a good sign. I think there's going to be a burst of demand here. Try to run as many through as possible, and then maybe we'll see the demand trickle off. We'll see. So Southeast Florida has about 60% of the current cases, and there's a whole bunch of resources that the state has devoted here to be able to help meet that challenge. We also have one in Orange County in Orlando, one in Jacksonville at the Jaguar Stadium. And, that's been a good story because it's been relatively lightly attended, even though they've expanded criteria. So maybe that means there's not as many symptomatic people up in Northeast Florida. That'd be good news. We also did one in the Villages retirement community in Central Florida. And that was interesting because, we had them, they take their golf carts everywhere. So it was more of a golf cart drive-through test. And we did do some stuff in conjunction with the University of Florida for clinical results. But we also did one of the first studies of asymptomatic people to try to figure out how the virus may be carried by those who aren't showing symptoms. So they did 600 people in the Villages who didn't have symptoms, ran them through the test. Fortunately, 0 came back positive. So that may be an indication. Some people say this thing's out there. Millions of people have had it, don't know it. Maybe, but this may be a counterpoint to that because there were no asymptomatic carriers in the Villages. We also did a couple of executive orders today. I was with the mayor earlier down in Miami-Dade. We did an executive order for safer at home for Southeast Florida. We have a unified approach in Southeast Florida. We understand that this is a unique community in our state. We understand you have a lot of international travel coming through Miami, a lot of interaction with New York City between both Broward, Dade, and Palm Beach. And so we view this as a serious challenge. So this executive order tells people safer at home. This goes through the middle of April, and then we'll reevaluate how things are progressing. But I can tell you some of the things that have been done here in Palm Beach, some of the things they've done in Broward and Dade. This goes back several weeks. I think it's been positive. I think people have changed behavior. I think you have seen social distancing. So we'll see how that looks as we go out another week or 2. But I think people down here really took it seriously, and I think that that's going to be to everybody's benefit. So in addition to the safer at home order, I also did an order to help bolster first responders and healthcare workers. Normally in Florida, if you've retired from the state workforce, you got to wait 6 months from your retirement date to be able to be reemployed by the any state agency. I'm suspending that prohibition. If folks want to put the badge back on, they want to go back into the healthcare field during this pandemic, we don't want any bureaucracy slowing them down. So we want to offer that for people, especially, you could have somebody in a police force or at the sheriff's department who gets exposes others, and then they got to self-isolate for 14 days. Well, you lose manpower very quickly. So I think this is one way to give some folks some flexibility, making sure we have strong manpower. We've also looked at we've done stuff with the exodus from people from the New York City area, which is the epicenter of this right now in the United States, actually in the world. And so folks are going to need to self-isolate when they come in. There's folks at the airport from the National Guard, Department of Health, getting the information, explaining, what we need in Florida, because, we're working hard to try to deal with all this stuff here. We got a lot of challenges, and to have the virus airlifted in from all around the world or the country, that's a big problem. And so I think this is the best way to be able to deal with that. We're also applying that on the roadways, including on I-10 for people who are leaving New Orleans, which has now become, a big hot spot. So we have the FHP involved in that. Another thing that we're looking at and really have prepared for since day one is hospital capacity. Jared, immediately when we started the state of emergency, procured field hospitals. There's one set up in Broward, one set up in Miami. We have the ability to do more. We also have different facilities which can be converted into hospital rooms or hospital beds if need be. And then I've been in discussion with FEMA and the Army Corps about them doing something similar. Now, at this point, hospital vacancies are very high in Florida. You got about a third of the beds statewide are empty. Our figures have Miami as 33%. I talked to the mayor, county mayor. He said that they're at 40% vacancy right now in Miami-Dade. And so part of the reason they're doing all the social distancing and all this stuff with the schools being out and all the other things that have been tough for a lot of people is because you want to make sure to spread this out so that the hospital system doesn't get overwhelmed. So that's something that we're monitoring on an hourly basis, and we've made a lot of contingency plans. But as of right now, that is what the hospital situation looks like in the state of Florida. So I want to thank everybody who's been involved with this. I'm excited that folks are going to be able to come out here tomorrow and get some tests done. And as soon as we have the ability to get more rapid tests deployed, believe me, we are going to do it, because I understand how frustrating it could be to get a test, it gets sent off to a lab, and it's waiting in line with 20,000 other samples, and it takes time for that to go through. To be able to get a quick result is more efficient for our purposes and better for people's state of mind. And so the final point I'll make is, one of the reasons why we're doing this in Southeast Florida, the testing, safer at home, social distancing, all these things, is because if we can continue to work hard and slow this spread of the virus, every single day you do that, you are giving people throughout our country the ability to innovate and provide solutions for this. The amount of products that have been developed just in the past couple weeks is really mind-blowing. But you have all levers of society who are on board to try to deal with this, and that may mean the rapid testing, it may mean the antibodies, there's a whole bunch of things that it means, but the more we can do a good job here, the more you're going to have an opportunity to really harness that. And I think this pandemic is going to end because of the technological know-how and ingenuity that we see throughout the American people. And I'm awed about what I've seen already, but I look forward to even more good stuff being brought down the pike so we can keep people safe. I'm going to introduce Jared, then the mayor, then we'll take a couple questions. Jared?
Governor, thank you. I want to thank the employees of Palm Beach County. I want to thank the mayor and the county commission, as well as the county administrator, Bill Johnson, the EM director, all of the health systems involved, and the National Guard. Obviously, when Palm Beach County wasn't selected for federal sites, everybody stepped forward to make this happen in record time. And so I want to thank everyone for their commitment. I also want to thank all of the first responders, all of our healthcare workers, our doctors, our nurses, who are really on the front lines of COVID-19 every single solitary day. And so we continue to look for collection kits under every rock, and every crevice in this country. We got 15,000 of them in today. I expect another 5,000 in on Tuesday. So we will continue to feed these sites to increase testing, and we look forward to potentially being able to support additional sites around the state of Florida. We have been focusing on PPE, and I want to thank FEMA and HHS. The governor talks to the president every single solitary day, and I want to thank our congressional delegation for pulling together to really make sure that we get those deliveries from the SNS, from the Strategic National Supply. And I'm happy to report that we've received 500,000 N95 masks, 250,000 face shields, 714,000 gloves, 1.2 million surgical masks, and 200,000 gowns from our SNS push. And so we thank FEMA. And we thank the HHS. We've been sending collection swabs to all the counties, even where we don't have massive drive-throughs, because we understand that there are 67 counties in the state, and that we got to make sure that we're spreading our resources, even though South Florida is obviously the focus. And so we've been sending collection kits to Baker, to Collier, to Charlotte, to Pasco, to Brevard, and we will continue to support those county health systems to do testing in counties that believe they need it. All sorts of different supplies are coming into the warehouse in Orlando. We have purchased 3,000 beds, 150 ICU beds. We have purchased now 3,000 different ventilators. We've received the first 500. I'm expecting another 500 in the next coming weeks. And the federal government has sent us 300 ventilators as part of our beginning request. We have 300 nurses on standby that we also secured, as well as the National Guard medics that have been activated. And so, as the governor alluded to, we're talking to FEMA and the Army Corps of Engineers at permanent facilities to deal with COVID-19. That's a medical station, potentially in a convention center, similar to what's happening in New York, as well as hotel to hospital conversions to try to increase ICU bed capacity in the state of Florida. We continue to obviously focus on social distancing. We want our elder population, our most frail and folks with pre-existing conditions to stay indoors other than any essential travel that they believe that they have to do. Lastly, I want to focus on one thing, because the president said in the Rose Garden yesterday that the state of Florida and the governor is being extremely aggressive. And we are being aggressive. We're specifically being aggressive when it comes to PPE, which is why I feel compelled to tell you what is happening in the private market when it comes to N95 masks. The N95 private market right now is like a Ponzi scheme. I have a boiler room literally set up in our EOC, and all day long we try to find these masks. We're talking to brokers, we're talking distributors, we're talking to medical salespeople. We're chasing down warehouses only to get there to find out that they're empty. We're being told these supplies are on planes only to see that they're phantom planes chasing ghosts when they don't appear on FlightAware. We're constantly engaging in bidding wars, being asked to wire money to accounts that were set up that very same day with email addresses that were created only a couple of days ago. I talked to fellow emergency managers around this country, and they are experiencing the very same thing in the private market dealing with these N95 masks. And so, I appeal to 3M and the other manufacturers. My EOC is in Tallahassee, the warehouse is in Orlando, and I ask that you sell the division and our hospitals and our first responders these masks directly at market price, and you cut out your distributors and you cut out the brokers. The governor is going to continue to do everything we can to make sure that our healthcare professionals and our first responders have the PPE that they need. We will chase down every lead. We will spend whatever it costs. But these manufacturers must help us do the right thing. Lives are on the line, and that's what's happening in the private market when it comes to N95s. And so, I want to again thank FEMA and HHS for really stepping up and helping fill those gaps. We've really turned the page on other issues with PPE, dealing with gowns and gloves and face shields and goggles. But on the N95 mask issue, right now there's madness in the market. And so, Governor, thank you for supporting this site and letting the division play a role in it. And again, I want to introduce the mayor.
Thank you, Director Moskowitz, Governor DeSantis. Thank you from the bottom of our heart for your leadership and for being here with us today. I can tell you, ladies and gentlemen, as your local county official and county mayor, how proud we should be of the working relationship between your local governments here in Palm Beach County, Broward, Miami-Dade, and Monroe counties, and the state of Florida and the governor's office and the Department of Emergency Management. You've heard sort of a little inside look into the operational difficulties that COVID-19 pandemic has raised in this nation and in the entire world, quite frankly. And I can tell you how comforted I am in working directly with the governor's office and Director Moskowitz. I can tell you that we've had many a conversation and text message and long calls about how we're going to be able to respond to this because we have to bring the operation inside. And to hear Director Moskowitz talk about trying to find these supplies on the private market, and then when we pulled that trigger, within a couple of days, these soldiers have put together one of the most incredible and efficient sites in the state of Florida. I think this site will become a base of operations because I've been told that you will give us as many of the testing swabs as we need. And we have sat down together to say, what can we bring to the table? What can the state bring to the table? What can our partners and other communities bring to the table, so that we look at this as not just a community issue, but a regional issue and a state issue. I will also tell you that the governor signed, I was with the governor this morning in Miami, and he signed an important executive order relating to law enforcement officers. When I talk to you during these press conferences about the civic duty and the patriotic duty that you have to abide by the social distancing guidelines, it's to save lives, and we all understand that. It's to flatten the curve. But I want you to understand that as frustrating as it is for you to be at home, to be safe at home, our first responders have to do that and deal with that and then go out into the public because the emergencies of day-to-day life continue through this pandemic. And the fact that the governor has to sign an order to allow retired officers to come back is indicative of the struggles our first responders are facing and our soldiers are facing and our healthcare workers are facing. So I call on you to maintain that civic duty that you have as a member of this community and as an American to maintain the guidelines and dignity of these proceedings because this pandemic is serious. I was talking with our director of the healthcare district, R.C. Davis, who's behind here, and she told me about two people, healthy young men that went into a hospital here with minor symptoms, a little slight fever, and then by the next day they were intubated. Please do not forget the cost that comes with this and the cost that comes when we have to quarantine our first responders. That's not fair to them and it's not fair to our community. So maintain your diligence. And Governor, thank you for the resources. Thank you for the leadership. Thank you for the supplies. We will maintain that commitment to the severity of this situation and we will come out stronger as a county and as a state. One last thing I'd like to say, General Eifert, sir, thank you to your men and women in uniform. They have been outstanding. This is a world-class facility set up under difficult circumstances. You bring great honor, and these soldiers bring great honor to this great state of Florida. Thank you, sir, for your service. Governor, thank you for joining me here today in this county that we love, sir.
Great. Well, thanks, Mayor, and I really want to give a shout out to the National Guard. They've been in this fight. We activated them, early on, and anytime we've needed something like this, it just happens. I don't have to worry about it. You don't have to, worry about whether it's going to be done right. It is, and so I want to thank General Eifert, thank all his team. They've really been a force multiplier here for the state of Florida. And we were. I remember doing the baseball spring training dinner about a month and a half ago. We knew coronavirus at the time, but society hadn't really shifted in this direction yet. And we had both of the teams here. I was looking forward to be a neat spring. I know a lot of people were probably wanting to boo the Astros after everything that came out. But it just reminds me of, we have a lot of great things in this country that we've taken for granted. This is a challenge, but I do think it's a challenge that the people are rising to the occasion on. And I think that next year, I think we'll be able to be in places like the ballpark enjoying life again. With that, happy to take some questions. Yes, sir. Oh, sorry. No, April 15th. I'm sorry. Yeah. So we're going to go. It's till April 15th, but we're going to be evaluating every day and seeing kind of what some of the trends look like and how things are. I can tell you, I really believe. I think it's going to take a little time to see it because there was no real testing being done in the United States in like February. CDC basically said if you're coming back from China, then you isolate or do it. But there wasn't a belief amongst the CDC that this was spread out or that this had been circulating in America. I personally think it was in Miami during the Super Bowl looking back, but that's not what people thought. So we're getting information. We don't really have a good baseline, but we're looking to see what's happening with all this. But I do think that there are certain things like how flu has really gone down. It usually is done by sometime in April, but in March, you started to see this going down across the country because I think people are now taking precautions. I mean, I never took precautions against the flu. I would shake hundreds of hands a day. I haven't shaken a hand in a month. I'm constantly washing my hands. You're seeing that. People are making those judgments. And so, yes, we're going to be looking at that. So we're mid-April, see where we're at, and then go from there. And I think the president, by doing the 30th, I think he thinks we may be in a better spot before the 30th, but I think he wanted to rather move in rather than have to move out. For us, we're just going to take it a day at a time, have everyone be in there, do a good job, and then see where we're at. But I do think that because of the actions that we've seen with counties like Palm Beach, other things around the state, I do think that that people have been doing the right thing, which is a good thing. Well, so we're looking at Southeast Florida, and so you do have stay at home, which is I think a testament to it's a very densely populated part of the state. You have a lot of international travel coming into Miami. You got a lot of travel back and forth through New York City, which is the epicenter now. And so I think the virus was going to perform a little differently in that environment than maybe some others throughout Florida. Now we have done stay at home statewide for those 65 and up. Or people that have significant underlying medical conditions. And if you look at this virus, the overwhelming number of people, or overwhelming number of people end up hospitalized or suffer fatality are in those two groups. And so whether you're in Pensacola, Jacksonville, Orlando, Palm Beach, we're asking to do it. But I also think if you look at how the virus is performing in different communities, it probably would be counterproductive to apply that in certain areas where, you have other strategies in place. And keep in mind, not only do you have the 65 and up and the medical conditions, which is above and beyond what the president has called for in his task force, but we've implemented the task force guidelines statewide, and so I think it's a more tailored approach, and I think ultimately it will lead us to have better outcomes, and I think it allows us to avoid some potentially unintended consequences in other parts of the state. Yes, sir. Trying to hire more people, and it's a very crunch, but going online you will get better results just because it's going to be easier to deal with it. I think people understand we had a 2.8% unemployment rate. We literally, I had people in the unemployment office working for DEO where the director came to me and he said, look, I don't really have enough work, but they'll leave by attrition. I'd rather not fire people. I'm like, that's fine. But that was a much different world. Now you're not just ramping up for a recession. Because if you look at the unemployment claims nationwide and compare it to the financial crisis, it is way more significant. And I think it's going to get more significant. So that's just a logistical challenge. So Ken Lawson, I've directed him, get as many people as you can to be able to process this. But I do think online would be better. I think people will have better luck doing it online just because of the manpower issue. I'd imagine you'll see people added. I know he's trying to execute as many contracts as he can with different companies that provide this type of support. But this is a crush that we've never experienced in this country, where you have unemployment go here and then all of a sudden go way up there. And in Florida, we were trickling along. We'd have 200 claims, 500 claims, 900 claims a day. Now we're 15, 20, probably have had 25,000 this week. That's also going to be a challenge on the back end of this. And, I'm mindful of trying to do this in a way that's not going to do unnecessary damage to people's livelihoods. Some of the safer at home here, given the circumstances, it's unfortunate, but that I think the locals and me and CDC, we believe that that's a good path forward. Some other places, we're mindful of how that could affect people, but it's going to continue to be an issue, and I just let people know we are working on it. But it's this is not just 0 to 60. I mean, this is like 0 to 120 trying to do it. Yes. We're going to look at it, and I'm also going to look at how the federal, so I have people in my office, we have people in the legislature looking at this massive bill and how this is going to affect. Actually, you had 3 bills. One was more health care, but you have 3 bills that have passed. And so we're looking at that to see what that does, what our options are, how much money we're getting. So we'll be doing it. I would say, though, I hope that if we do our job here and do a good job in the near term, that may obviate the need for this to just be a protracted situation. I can tell you, if you have those types of unemployment claims 6 months from now, that means society is going to be really in bad shape. And I think that would be a very, very bad thing. And I've talked to the president about it. I know he's mindful of some of the effects. And so that's why I think these 2 weeks are really critical. It doesn't mean it's going to be over, but I do think that this is an important marker for us to take a stand on. But we're going to look at all that. We're going to see what's best for our folks, not just the employees that got laid off, but you have small businesses that went from being successful to basically being out of business without a lifeline. A lot of them can get through 2 weeks. They may even be able to get 4 weeks through, but they're not liquid enough to go through this for 6 or 8 weeks. I know Senator Rubio worked hard on that provision in the big stimulus bill, and we've done bridge loans in Florida as well. But that's small business. The big companies, they're going to furlough people. Once it gets better, they'll hire. But some of those smaller businesses, the family-owned businesses, it's an unbelievable crunch. And I just think it would be a shame if, through no fault of their own, they weren't able to get back into business. I don't think so, because I think they're going to send them all to either Quest or LabCorp. And we're also in discussions, Jared, actually I haven't talked to him today about it, but there's another testing company, lab, that we were looking to send things through. And it's unfortunate that this doesn't turn around quicker, but the United States went from, I don't know how many tests had been done in February, but it was in the thousands probably, to now I think we've hit 1 million tests. And so there's only so many commercial labs. They send it all through, but when you test it, you can run it through the machine. If you run one through the machine, then the machine's taken. So they fill it up, they run it all through, and so the end result is it just takes time. That's one of the reasons we're leaning in so much on the Abbott Labs instant test, because if you can get a point of care test, you put the sample in the machine just like a flu test, then all of a sudden, if you're in a nursing home, the workers are fine. You can check the seniors. Healthcare workers will be able to do it and know what they're doing right away. So there's a lot of promise in being able to do that. And I do think we're going to get some. I'm optimistic we're going to get some. I think they're going to be making 50,000 a day for as far as the eye can see. And so you see how having that type of technology at our disposal is going to affect our ability to fight the virus. It's going to allow people to have more opportunities, to do things. I think some of these restrictions would probably be able to be loosened, and I think that's all in all a good thing. Okay. Fact, we just mentioned what they're estimating now, and I don't know that the May estimates are usually. It's hard to do this stuff this far in advance, but as of right now, they're projecting another active hurricane season. We had a very active one last year. Fortunately, we had a near miss with Dorian. It didn't hit us, but I would say in terms of the financial preparedness, I do think because of this federal bill, we should be able to get money for this. And so we're spending money, but I think that we'll be able to get reimbursed for what we're doing with the Guard, all the supplies we're buying. And we're willing, not only are we paying market, if we can get it sooner for our people, we're even willing to pay more just because of the crunch for the masks and all these other things. And so So financially, I think, we'll be able to weather it from the government perspective. I do worry about, how the social fabric holds up. We'll see how much longer this goes. But I can tell you, it's to go from a normal life to now something much different. There's going to be a time when people get really tired of this, and then going into hurricane season, we'll see. We'll see how the virus sustains itself. But yeah, look, you go from one emergency to the next. It makes it more difficult. But we'll be ready to go for it. These guys in Florida with Jared and his team, and then my office. We've been pretty much, we've been 7 days a week, all March, all the way up here. We were dealing with it in February, but we've been at a level 1 for most of the month now, and people are turning. It's every day, and people just aren't getting any rest or anything. But that's what you sign up for. But it's a lot, and so hopefully we don't have a hurricane, because I think that I think the people of Florida have been through a lot, and I think it would be great to just say, you know what, we could maybe have a more eventful summer. Thanks, everybody.
That was Governor Ron DeSantis here at the Fit Team Park on 45th Street. Military Trail just south of 45th Street, which is where the new testing site will be open tomorrow. You can see on the field here, the tents are set up. The governor spoke to us about the the increase in the number of tests, but also the point of care test, which everyone is really betting on, and that they're hoping they can get that out. One of the other big questions that was asked today was about the unemployment insurance. We know that many of you have tried to apply for unemployment through the government, and you get on the website and you simply can't get through. You can't reset your PIN. You try to call many times, you're not getting through. The governor says that they are working on that. And a couple of other things that they're working on in terms of getting your unemployment is, will they increase the duration of unemployment from the current 12 weeks to 26 weeks? And also, will they increase the amount that you're eligible to get? Right now, it's about $265. And so those are things that the governor said that the legislature and his office are both working on. And he encouraged people to continue trying to go on the DEO website to apply for the benefits. I'm here with several of our reporters, and we will continue bringing you coronavirus coverage in the field as long and as safely as we can. Thank you for tuning in.